Yeah, greetings. I want to talk about autism today. It's something that is now very common globally, and is the prevalence is increasing in Nigeria day in, day out. So we used to hear of autism in the European world, in America, in Europe, but now autism is now prevalent in Nigeria and even in Africa. So I am going to talk about autism today, the causes of autism, the theories surrounding the causes of autism, the symptoms of autism. How do you know that your child have autism? Then the treatment, more or less the treatment. So autism is a condition that affects the child mentally, socially, physically, eh, and functionally. See, an autistic child has an issue with interacting with both humans and the environment. They have serious challenge with interacting with both humans and the environment. So, what causes? And don't forget that autism is a spectrum. It's a spectrum ranging from autistic disorder itself, uh, Asperger syndrome, pervasive developmental disorder, and other spectrums. And each of these spectrums have their severity. Some can be mild, some can be moderate, some can be severe. Now, what causes autism? Right? What causes autism? Autism can be caused by um, so many things. What causes autism can be genetics, it can be social, it can be environmental, right? Now, autism has been found in some families. If a child is from a family where there is a member of that family that has autism, the child can develop autism too. Any child that is from a family that has any of the relative that is autistic has a chance of developing autism, right? That is that. Then um, autism must also be found in children that did not cry early at birth. In children that did not cry early at birth. So if a child did not cry early at birth, the child has a chance of developing autism, right? Children that are born to older women, that is, when older women have children, the children stand a chance of developing autism, right? During pregnancy, what the mother does also have a long way to go in determining whether the baby will become autistic later. A pregnant woman that drinks alcohol, a pregnant woman that smokes, yes, can have um, a child that has autism in the long run, right? They can have a child that has autism in the long run. Um, which other social factor? Okay, but I said something about older women. That does not mean that younger women cannot be autistic or cannot have children that are autistic. Oh. Personally, I've seen children whose parents are not up to 30 years, but the child is autistic. Now, a child that the mother had fever, especially all those chicken pox, measles, during pregnancy has been found to stand a chance of developing autism. You get. So that's why any fever you have in pregnancy, you must make sure you treat it aggressively. Um, Children that have some form of genetic abnormalities, right? Genetic abnormalities like Down syndrome. Children with Down syndrome stand a chance of being autistic, right? There's also some there's what they call metabolic errors of metabolism. Children with metabolic errors, they stand a chance of developing autism, right? Trauma, trauma. What I mean by trauma, maybe a child that falls very badly when they were very young and hits the head, they stand a chance of developing autism. These are some of the risk factors. You can see that also a child that grows up in an environment where um, people don't talk stand a chance of developing autism. So that means you must start talking to your child as early as possible. Communicate with your child, whether they are able to talk, but let them see your mouth moving. This is the little research I've done. There are so many other causes. Herbal preparations, right? Right? Then some medications. Some pregnant women take medications that were not prescribed for them. They just swallow it. And it has been found that that baby, the pregnant woman stand a chance of having an autistic child, right? Um, where I've mentioned environment, which other environmental factor have I not mentioned? Okay. Um, there are some diseases in childhood that has been found to cause autism, right? Okay, I've mentioned a child that did not cry early at birth, right? When the child is born, it took time for the child to cry. Anything that will cause brain injury in a child can cause autism later, right? Anything that will cause brain injury in a child, whether during birth, can cause autism later. Uh-huh. There is also a research that showed that a child that grows up in a in a household where there is no love between the parents, they stand a chance of developing autism. Now, the symptoms of autism are many, but this is what I will tell you. And the funny thing is that a child can develop, or you can develop the symptoms of autism as early as 1 year. And how do you know? The child does not show any sign of interacting with the environment. One, the child that used to talk before, maybe dada, mama, all of a sudden is not talking. The child does not smile. Because these children, autistic children don't really show emotions. They don't show emotion. The child does not smile. You smile at the child, does not smile back. The child does not talk. It took the child time to start speaking, time to start walking, delayed developmental milestones. Those are already a sign that this child could be autistic. The child does not recognize you. Have you seen an autistic child before? Whether you are there, you are not there, they don't care. The child does not recognize you. You go out, you spend long outside. Normally, when you come back, the child should show sign that they missed you. Oh, mommy, daddy, welcome. But you just came, the child just looked the other way and just go as if nobody came into the house and concentrating on what is not necessary, like concentrating on what on objects, toys that irrespective of the fact that you are just coming into the house, the child is more interested in the toy, playing with the toy. Those are signs. So sometimes the child can be very violent. Eh? Their approach to issues, right, can be funny, can be weird. They can be violent. That is, in a bid to approach something, in a bid to get something, they can become very violent just to pass a message, violence. Why some can be passive though? Then they don't eat. Children that are autistic, they hardly eat. Oh, they don't have good appetite for food. They don't eat. That's another problem with them. Then they have learning difficulty. Learning difficulty. They are not doing well in school. They are not doing well in school. So it can be so bad that they need to put them in special schools. They need to put them in special schools so that they can catch up because they cannot catch up with other children that are not autistic. So they end up putting them in special schools, especially in Europe. They'll put them in special schools. They don't understand language. They don't even understand sign language. Like, they don't understand. They don't understand what you are telling them, right? They don't understand anything that you are telling them. And another thing is that they can be so concentrated on something and you'll be wondering what are they concentrated on. Like, they can just pick interest in one very funny thing and you are saying, what could this be? Why this level of concentration? It can be that way. Also, they may not even be talking to their siblings. Autistic children, they don't even care whether they have siblings, they don't care whether they don't have siblings, they may not be talking to them. They may even have no relationship with them at all. So those are some of the symptoms. So if you pick these things very early, because the earlier you pick it, the better. Autistic children also have issues adjusting to being teenage and adulthood. They cannot adjust. That transition is difficult for them. You will notice that they cannot do things for themselves, right? An autistic child can stay without even thinking. A teenager can stay without even thinking of baiting. They will not bait. So those are some of the things you need to take note of in autism. Then what is the treatment? I hope I've been able to highlight all the things. But just know that an autistic child, not smiling, they don't smile, they don't see anything as funny, nothing is funny to them. Please take note of that. And not having concentration, not concentrating on anything. They are not sociable, they cannot interact with their peers. They cannot interact because their peers don't understand them, they don't understand their peers. That is their age mates now. See, there's no cure when it comes to treatment. There's no cure for autism. Oh. No cure. And the only thing they will do for you is called psychotherapy. Yes, another thing about autism is that they may have issues with talking. I nearly forgot that. They may have issues with talking, communicating. Talk, they will not talk. It will be so bad that they may even get to 8 years, 7 years, they've not started talking. Oh. And if they say anything, it's just what does not make sense. You will be so it can be so bad that they may tell you that it's because the child has tongue tie that you should take the child to hospital so that they will do surgery to release the tongue. Only for you to get to the hospital, the doctor will tell you that there's nothing wrong with the baby's tongue. That is even making me remember now. Eh? The child is not just talking. Child is not behaving like what how you expect a child to behave and the rest. And there's no treatment and there's no cure. The only thing they will do for you is if the child is too anxious, they'll give you anxiolytic. They'll give you medications that will calm the child down, especially those very active, hyperactive ones. Please, autism is different from attention deficit hyperactivity disorder. It's not the same thing. Uh-huh. All those because there are some autistic children that are hyperactive, they'll give you drugs to calm them down. Right? Another issue with autistic children, please identify, is that they don't sleep well. They have issues with sleeping. They don't sleep well. So all they will do for you is medications. They just take medications to calm the child down. It's not that the medication will cure the issue. It's psychotherapy, behavioral therapy that they do for such children. Now, I want to talk about one myth. Vaccines do not cause autism. In fact, the Pediatric Association, American Pediatric Association, have done a research and they came out with a paper to say that vaccines, immunization, does not cause autism in children. If that is what you have heard, just discard that because your child need to be immunized to stop all those killer diseases, childhood killer diseases. But vaccine has not been shown to cause autism. There was a serious research into this, and it was shown that there's no relationship between a child that had vaccines and autism. I hope you get. Do you have any questions? Is there anything I've missed that I didn't say? But there are a lot of information. I just try to compress everything. There's a lot of information out there about autism. But just know these things. The causes can be social, can be genetic, it can be environmental, right? Uh-huh. And please share this video because autism is becoming quite rampant. There's one video I saw one time of a child that was destroying things in a shopping mall. People were saying, if I was the one, I would beat the child, I would do this. That child is autistic. Oh. I hope you know the father later came out to say the child is autistic. So that is another behavior they can exhibit. They don't know how to interact in public. Public gathering can scare them and they become violent. The father of the child later came out. There was a video and said the child is autistic. That sometimes they have such episodes. And please, take note of autism. And this is an autistic awareness video. Autism awareness video. Um, Autistic children should be taken care of, should be cared for, and never be abandoned. Right? They are just like you and I. As more research goes about the cause and the treatment, there will be improvements in their condition. So do not discriminate against autistic child. Then there's another video I saw of an autistic child in the US that beat up the teacher, beat her up, and even wounded her. But the child is autistic. So they can have some violent episodes. Take note, but that does not mean you should discriminate against them, stigmatize them, or bully them. Because there's also autistic bullying. Show autistic children love and help share this video. Thank you and bye bye.